Assistant Professor of Psychology and Psychiatry at Neomed, and is an adjunct Assistant Professor of Psychology at Kent State University and Ashland University. Please join me in welcoming Dr. Joel Mowrey.
Are you ready for some group therapy?
Yes.
All right, Todd. Let me first introduce two people. First of all, I'm glad to see we have one of our esteemed board members, Major Dennis Bassimi, back in the corner. Excuse me, Dennis. He is one of our my 18 bosses. We have an 18-member community board, so I have to be very careful today.
And today's my day to watch him.
That's right. I put my ankle bracelet on this morning, so. And I have Amy Chaika, who's our Director of Community Relations. There's a rumor that she wants to retire at the end of the year or so, which unfortunately is true. So, but she, by the way, please, this handout here, I'm going to refer to it, and thanks to her, we sort of put this together, and I appreciate that. Very quickly, actually, if you turn on the other side, it talks about what is the Mental Health and Recovery Board. Basically, these boards were established back in 1968. There's 53 boards across the state. And there's really, the function is to plan, fund, and monitor mental health and addiction services, and in particular here in Portage County. If you go to the bottom of the page, we have 4 service providers that actually do the service. Because our board itself, we have 5 people at the board. It's really more of an administrative staff, along with our 18-member board. But the agencies that we fund do all the work in terms of providing the mental health and drug, alcohol kinds of services. And that's Coleman Professional Services, Town Hall 2, Family Community Services, and Children's Advantage. So, there's numbers back there. You're all an educated group. But before we go any further, speaking of an educated group, I want to know my population here, who I'm talking to. So I have a couple questions for you. First of all, how many of you have any kind of have ever had a physical health problem? Colds, flus, headaches, stomach aches. Right. Okay.
Just today?
Just today. Any time of your life. Of course, everybody. How many of you have ever been stressed? Yeah, I have to come here today, and this is a stressful thing, listening to me, so. How many of you ever have mental health problems? That's what I figured. Uneducated group here, or lying to me, or whatever. Remember our first speaker, Laura, talked about physical health problems, the holistic thing, it's mind, it's body. Because if you have a physical health problem, your mental state, your emotional state, it gets affected. And likewise, stress, by the way, is a mental health issue. So we all have mental health issues. But it can be to varying degrees. We can have our good days, maybe our not so good days. And then there are some individuals that may have more serious mental health kinds of issues, like schizophrenia, major depression, bipolar disorder. But it's on a continuum. So I throw that out because if you go back to the first page here, one of the first things that we always talk about and we're always dealing with here at the Mental Health and Recovery Board is stigma. Because a lot of times people, they have no problem telling you about how bad their constipation was last night. But they're going to tell you about how depressed they were, how suicidal they were, or a family member that's been hospitalized psychiatrically. That's private, they don't want to talk about it. But we do want to talk about it, it's okay. It's, mind and body go together. Behavioral health care is health care. So that's one of the issues we're always dealing with. A couple other really serious issues we deal with all the time is suicide. And you can see some numbers here. We tend to average about 14, 15 suicides in our county per year. One year we had, unfortunately, up to 28. It's been lower, but it's an issue that we work on all the time. A growing issue that we have, and I'd like to label it as a public health problem, and that's drug overdoses. And if you look at the numbers here, they have gone in the last few years from like a low of 4 to last year we were up to 22, and actually we're up to 19 already in the county. And if you look at the numbers here nationally and so forth,